Hello everybody, it's Dr. Ryan here again. It's a beautiful day to be talking about stroke. And thank you for joining me even as we navigate our way through this very common clinical scenario. All right, thank you once more for watching and liking, subscribing and sharing. I truly appreciate it. And I really hope that this series of videos is beneficial to us in our quest to be better physicians. When I think about a stroke, I remember a colleague once who told me that his pen was running out of ink, and I told him, well, most likely your pen is having a stroke. Anyway, so as we see, there are 27 causes of stroke outlined in this algorithm. As customarily the case, we divide into left and right sides. So we speak to hemorrhagic versus ischemic stroke, and under the ambit of hemorrhagic, we speak to intracerebral versus subarachnoid. Under ischemic, we're going to speak about three different portions. In situ occlusion, which is further subcategorized based on the size of the vessel. Is it large or small vessel? Ischemia. Then we speak about embolism and then watershed, right? So a quick foundation. Stroke occurs when there is acute infarction of brain tissue resulting in neurological deficits. Chronic hypertension is the most significant risk factor for stroke. Others, of course, include diabetes mellitus, atrial fibrillation, dyslipidemia, smoking, and family history. Strokes can be hemorrhagic 20% of the time or ischemic 80% of the time. So most of the time, we're looking at the right side of the algorithm, but don't neglect the left side. Hemorrhagic stroke causes injury due to mechanical compression of brain tissue and local toxicity from blood breakdown products. Ischemic stroke, however, causes injury due to insufficient oxygen and nutrient delivery to brain tissue. So the pathophys differs between the two. Neuroimaging is necessary to distinguish between your hemorrhagic and ischemic strokes, and hemorrhagic stroke is associated with a higher 30-day mortality in comparison with ischemic stroke, but long-term functional status among survivors is similar between the two. So let's dig in here. 13 causes of hemorrhagic stroke are subpartitioned into intracerebral, which is 10, and subarachnoid, 3. So homing into intracerebral, hypertension quite significant, right? Very prevalent amongst our clinical population these days. Cerebral amyloid angioplasty is another one, right? A brain hemorrhage could be caused by trauma, as we know, which can be intracerebral some of the time or subarachnoid some of the time, right? Bleeding diathesis. Now, note this, especially if the patient's on anticoagulation, right? Or if the patient has propensity to bleed because of some congenital deficiency of clotting factors, right? Then we speak to congenital vascular malformation as well, especially AV malformations, brain tumors. Needless to say, we can have bleeding into that, which is sometimes called apoplexy, right? We can also have aneurysms, which may burst. The typical example is rupture of perianeurysms in the setting of adult polycystic kidney disease, but that usually gives you subarachnoid hemorrhage, right? Then we got cerebral venous thrombosis, like superior sagittal sinus thrombosis, bleeding into that, moya, and of course hemorrhagic transformation. So sometimes you have an infarct and you can have hemorrhagic transformation of the infarct, and we categorize that as hemorrhagic intracerebral stroke. Right, going on to subarachnoid hemorrhages can be caused by trauma, most often aneurysm rupture, like we said, or perimesencephalic non-aneurysmal subarachnoid hemorrhage. So that's your 20% of strokes on the left-hand side. But 80% of the time, we talk about ischemic stroke, which is there's 14 causes, subpartitioned into firstly in situ occlusion, where there's 9 causes, and we subpartition that based on the size of the vessel, large versus small. So large vessel, as we know, atherosclerosis is the big buzzword in medicine. You got to know the pathophys behind atherosclerosis. It affects multiple systems, and is that underlying pathophysiology to much of lifestyle-associated disease that we see. So atherosclerosis is one. A big differential for that all the time is fibromuscular dysplasia, right? Then in the vessels, you can also have, in the large vessels, you can also have dissection, vasoconstriction or vasospasm, vasculitis. Vasculitis can be of autoimmune phenomenology, like in the setting of SLE, which gives rise to neurolupus, right? Where you can have vasculitis leading to infarcts, or it could be the result of an infective process like TB endarthritis in our patients with TB meningitis in the immunocompromised population. Moya is another one, right? Bleeding disorder as well, especially when you have deficiencies of your when you have protein C and S deficiency, antithrombin 3 deficiency, factor 5 laden, the thrombophilias, right? That can predispose to clotting. But usually hits the large vessel. Small vessel in situ occlusion, we speak to lipohydrosis, which happens with hypertension, and of course atherosclerosis, quite common. The other category of ischemic stroke is embolism. We speak to cardioembolism, and here we see it most commonly, for instance, with patients with atrial fibrillation. They have a left atrial thrombus and it shoots out to the brain. Or you can have a situation of dilated cardiomyopathy with a low ejection fraction and the LV thrombus which shoots out. Right, those are just two examples that come to mind. Artery to artery, where we speak to usually carotid vessel, carotid artery thrombosis, which then also shoots out to the brain. Paradoxical happens when there's an abnormal communication between the right and left side of the heart, and usually we have a pulmonary embolus, which then goes into the left side circulation and shoots out to the brain. Not very common. Right. Then watershed ischemic events happen in the setting of systemic hypotension, usually in the setting of shock, and there's going to be diffuse brain parenchymal perfusion, right? So the entire brain is deprived of blood flow for whatever reason, or you could have diffuse atherosclerosis, right? Okay, so here we had 14 causes of ischemic stroke and 13 causes of hemorrhagic, giving you a grand total of 27. Whoa, that's a lot. Okay, thank you so much for joining me for this algorithm. I just want to leave you with a scripture from Colossians chapter 3, verse 23 and 24. It says, whatever you do, work at it with all your heart as working for God and not for man. Right? And whatever you do, we should prepare prayerfully, plan purposefully, proceed positively, and pursue persistently. So think about the multiple P's in life. So God bless you and thank you for joining me. It's always been a pleasure. And next up, we're going to tackle the huge topic of weakness. Looking forward to seeing you then, and have yourself a brilliant day.